Hello, my name is Mirinae. Thank you for inviting me. Title of our study is Features of Undiagnosed Breast Cancers as Screening Breast MRI and Potential Utility of Computer-Aided Evaluation. Let me start by introducing a representative case. This is a screening breast MRI of a 31-year-old woman. Would you recall this woman for biopsy or not? Is this lesion a true lesion or background parenchymal enhancement? But if you see this MR-CAE, I think you might not hesitate to classify this finding as suspicious. This was proved to be a 1.6 cm invasive cancer 7 months later. Then how about this case? An enhancing mass in the right breast was mixed with multiple enhancing masses and foci on 3D MIP imaging. But if you see this MR-CAE, you can see the lesion shows a suspicious washout kinetic pattern. 7 months later, it was proved to be a 1.0 cm invasive cancer. Thus, the purpose of our study was to evaluate the features of undiagnosed cancers and prior screening breast MRIs in patients who were subsequently diagnosed with breast cancer, as well as the potential utility of CAE. Between March 2004 and May 2013, 72 pairs of dynamic contrast enhanced breast MRIs, including prior negative MRIs and subsequent MRIs, which lead to cancer diagnosis, were collected. The median interval between prior negative and subsequent MRI was 32.8 months. Two radiologists reviewed the 72 pairs of MRIs in consensus comparing the prior and subsequent MRIs. 36 prior MRIs were determined to have no visible findings, and 36 cases were determined to have visible findings which had been undiagnosed prospectively on prior MRI. Among them, CAE was available in 25 prior negative MR cases. We evaluated the possible reasons for the undiagnosed cancers, imaging features of the overlooked 36 visible findings, as well as the CAE features of the 25 lesions. In addition, we compared the imaging features and CAE features between the actionable and under-threshold groups. To determine the actionability, 5 blind radiologists reviewed the 36 false negative MRIs mixed with a control group of 65 MRIs of proven benign cases. The findings were classified as actionable if the visible findings of prior MRIs were categorized as 4 or 5 by 3 or more radiologists. Otherwise, they were classified as under-threshold findings. Let me show you our result. This table shows the clinical pathologic features of 36 women with undiagnosed breast cancers with visible findings on prior MR images. Of the 36 visible findings, 12 lesions were determined to be actionable and 24 lesions were under-threshold findings. All focused lesions and most of the non-mass enhancement lesions were classified as under-threshold. The mean lesion size of the under-threshold group consisting of all focused lesions was smaller than the actionable group. Visible findings in the breast of marked or moderate BPE were less definite than that of mild or minimal BPE, and were classified as the under-threshold group rather than the actionable group. With regard to the reasons for undiagnosed cancers, mimicking physiologic enhancement, small lesion size, mimicking post-operative change, and multiple distracting lesions were common reasons. As for MR-CAE features in 25 cases, 4 cases were not enhanced with a 50% threshold, all in the under-threshold group, and their lesion size ranged from 0.4 cm to 0.7 cm. Among the actionable cases, All regions were enhanced with a 50% threshold and showed a plateau or washout delayed enhancement pattern. As a result, actionable findings were more likely to show the plateau or washout delayed enhancement pattern, and on the threshold findings were more likely not to show enhancement or to show the persistent delayed enhancement pattern with statistical significance. In conclusion, MR-CAE has the potential for reducing actionable overlooked findings because more plateau or washout delayed enhancement patterns were found for actionable findings than for on the threshold findings, which can improve lesion conspicuity in cases showing greater PPE or having multiple distracting lesions. Thank you for listening.